welcome to State View. I'm Mark Crosby. Thank you for joining us. State View is a program that looks at legislation on the state level and helps you to stay informed. Joining me today is Representative Tackey Chan. Representative Chan, always a pleasure to see you. Welcome back.
Oh, thank you for having me back, Mark. It's
been a couple months.
Just about, and I always enjoy coming on and talking about different topics, and it's easy to do, and it's fun to do this.
Well, and it also keeps folks aware of what decisions are being made on Beacon Hill, because that does affect folks here on the local level, of course.
Yeah, and having us here gives us a chance to talk about things that the general news media can't, in terms of sound bites and short news, as well as the papers can only print so much. So, I always hope your audience enjoys seeing myself and Bruce Ayers, Ron Mariano, Jared Keenan, and a number of other guests come on to at least give you a more in-depth perspective and somewhat of behind-the-scenes look.
Certainly, the invite always stands. Anytime you'd like to chat, I am more than willing to interview you. So, before we get...
Be careful what you wish for.
Well, I'm thinking, should I have said that? No, I should have said that. I do want to start with the coronavirus, because that is all over the news. It's quite hyped at this point. I'm bringing this about because the Governor Charlie Baker, just had a press conference. I wasn't able to watch that. You, however, did, so maybe you could give some updates.
Yeah, I watched a little bit of it, unfortunately. I had another meeting and just dashed home quick enough to pick up and go and to turn on the telly. And today's March 12th, so the audience knows the context of which. So at this stage of the game, we've gotten more test kits, according to the governor. About 5,000 kits, as well as requesting the CDC to allow more private facilities to be authorized to confirm cases. As people have seen on news, the word we're using at the state level, and actually every state, is presumptive cases.
Correct.
Which for our purposes means positive, because only the CDC can verify positive. So what happens is that you have to test here, get the presumptive, ship the stuff to CDC, let them confirm. And given the slow pace of it, as you've all seen in the news, obviously we want more confirmations earlier on. And why is this important? Well, obviously data sets. We need to know what the data is, and we also need to do tracing. And we talked a little bit offline to be able to track people who contracted it all the way back to find out who originally gave it to the individual and anybody who could be potentially infected on the way. And not to belabor what you've seen on the news, it is not airborne. It is a close contact disease. It's a virus that comes through symptoms associated with the cold, unless you're literally on top of somebody, breathing on them, or sharing a cup, sharing utensils, sharing saliva, that type of thing. But generally, it's driven through common cold symptoms, all respiratory. The only thing about this that's different is it's very asymptomatic, meaning it takes a long time for the symptoms to occur. It is possible to transmit, but like I said earlier, you're literally sharing glass with someone, swapping spit, for lack of a better term, to contract it, as opposed to receiving a sneeze or a cough. And the incubation period has been kind of a moving target. The 14 days is the recommended, but there's also no guarantee that that is exactly the right time. One of the challenges here is that we're spending more time reacting than researching, and rightfully so, because we need to address this now as a serious disease, and obviously research is continuing at all levels, private and public sector. But right now we got to get a handle of what to do now.
We should mention that funding for the CDC had been cut.
Yeah, the Trump administration
makes
cut
it more challenging, of course.
Absolutely, they cut about 8-9%. The Trump administration hasn't appointed officials to the infectious control boards. Infectious division has a short of people because the administration hasn't done that. At our level of government, the House and Senate has authorized $15 million, which should pass very quickly early next week to the governor for emergency funding for now. The legislature, led by Senator Lesser and myself in the delegation, asked the Commission of Insurance to waive fees on the testing kits. So we have done so in Massachusetts. We did that last week. Division Insurance agreed to do that, and not surprising at the federal level, they followed suit about 5 days later to do that as well. So a test kit will not be charged to an individual that needs one.
You could certainly have a person that would say, well, I can't afford to be tested for this virus.
Absolutely. Absolutely right. You don't want someone to continue to carry the disease because of fear of cost, which is a larger debate of healthcare. We're going to have another discussion, but this is a very emergency situation that requires emergency response, and discouraging people from asking about medical conditions, getting tested, informing the employer, trying to stay at home if ill is crucial now. Someone's brought up to fight our way through a code. Well, this is a code, but it's like the angry Big Brother version of a regular code. So
same virus, but different strain.
Yes, it's in the same family.
Right.
It's a different strain. It's a strain we've never seen before. Most people don't realize that you've been fighting codes your whole life. That code keeps evolving as you grow older. So as a result, you've been doing it all the time. But this one's special because your body's never seen this variation before. So as a result, our ability to respond immune-wise has been tough. And we've seen in the news, older people, especially over 70, people immune compromised, have been first. Meanwhile, younger folks, particularly teenagers, children, and early 20s, do contract, but lower level of severity. So it can range, like I said, from a sniffle, which you've seen in the news, all the way down to full-blown pneumonia.
Right.
And this is the challenge here is diagnosis. And tree pollen's up this week. We saw that in the news. So you're going to be sneezing. You're going to have itchy eyes. I had itchy eyes yesterday.
Yeah.
Which creates another question about whether you're sick or not. And
exactly.
we once again, strongly advise people to stay with the Department of Public Health website, stay with the CDC, keep up the press conferences on YouTube because you can watch it over again, and at various news stations, use the local news station. Don't use national media, because the local news stations will update you what's happening here. And you had Ruth from the health department over earlier.
Right.
Very encourage people to get online after, just turn me off, hit pause, and go to that right away.
Hit pause.
Hit pause. Just move the other video to watch that as well. And we always say
you will both be on equal time. We do equal time here.
I think that might be a little more interesting than me today.
Well, not necessarily. Let's talk about, one other thing before we leave the coronavirus. Gatherings on the state level, what did the governor say about that?
The governor's sponsored events at the State House have all been canceled or postponed. Speaker of the House has also done the same thing. Speaker's postponement goes to April 6th. The Senate most likely has the exact same moratorium on events inside the building. As a person who attends a lot of events, if you see me around, cancellations occurring everywhere.
Right.
For example, I got an email even locally for the Marymount St. Patrick's Day party down at the beach. Is pretty much an all-day affair. Has been postponed as well, or I think it's been canceled more accurately. But the Quebec Seafood Conference that was supposed to be on Monday was canceled, a very late notice cancel, and that's a huge deal. Seafood's our 5th biggest export item out of Massachusetts, and a huge shipping issue. So the Quebec Seafood Conference is a major event.
I do need to mention this in light of businesses, because you did have a Facebook post, Twitter or Facebook? Facebook, that had you at Asian businesses in the city. Numbers were down at Lunar New Year, so there are businesses, not only Asian businesses now, that are suffering. I think initially Asian businesses were suffering because of the concern of where it started.
That's correct. I mean, we've been through this before. If you're old enough to remember SARS in 2002, 2003, that very heavily impacted Hong Kong and Guangdong province, but obviously spread beyond that.
Right.
There was a lot of misinformation and fear, as well as, frankly, racist behavior and discrimination on particularly Asian people and especially Chinese folks during that time period. And unfortunately, some of this has appeared again. Social media is much more prevalent because we could just make a fake account and say what you want.
True. And
post what you want to say. I'm sure people will be posting after this regarding even this comment I just made. But there's also adverse impacts. I mean, it doesn't have to be a Chinese business. You got Koreans, you've got Thai, you got Indian. You have a large volume of diversity of Asian American businesses. And I thought it was very important to put in Facebook actually a very short notice decision to move from North Quincy down to Quincy Point to or South Quincy. It's just outside the point, so South Quincy.
Okay.
I do know my Quincy geography.
I was going to say, I think you're
just a little bit off. Yeah, South Quincy to highlight some of the business we have and show you the great, enormous diversity among Asian Americans. We have Vietnamese, we have Korean, we have Thai, we have so much here to offer, and that even though there is a issue regarding public health, to just be wise about the fact and smart about the fact that it shouldn't stop you from doing business. And the different Asian markets cater to a very broad range of people, and their business is down, but it hasn't inhibited people from actually going to shop. And give you an idea of misconceptions. People wear masks these days that you buy at the store. They're all sold out. But those masks are designed to keep your germs to yourself.
Correct.
It contains the phlegm. If you look carefully in the mask, you got this little gap on the side. Well, that's your air coming in, because you still got to breathe. But as a result, people keep buying all these products under some false pretense. It keeps disease from entering the body. It actually keeps your phlegm to yourself. So if you are ill, wearing a mask is good, because you don't want to spread germs. Change your mask once it get wet, because it doesn't help you anymore if it's all soaked through. And we tell people, and you saw this in the news as well, you have to buy the surgical level respirator mask they use in hospitals to do complicated surgery, so you don't cause infections as a surgeon. Or you have a full-blown respiration for environmental issues. There's an example of that. And why the toilet paper run? I've been asked that question.
Oh, that's right too.
The toilet paper run. It's because in Chinese social media, they have advertised that surgical masks are made of toilet paper.
Which is false.
Which is completely false. They say it's the same material, so as a result, they're going to make a lot of masks, so materials available to make toilet paper will no longer be available. It's not just in this country. It's happened in Taiwan. It's happened in Hong Kong. It happened in Singapore. All these other heavily Chinese-dominated regions are buying toilet paper en masse. And no, there is not going to be a toilet paper shortage, because a lot of masks are being produced. So give you an idea of a little bit of misinformation that's never been cleared up in the mainstream media. So I hope people do
that
not
will continue
do
to
that.
happen as well.
Well,
There's fear
yeah.
of that naturally.
It's a fear of that, and but it's, like I said, it's interesting. During a snowstorm here, you buy eggs, bread, and milk.
Correct.
Even if it's only 3 inches. A mad dash. Now we're buying toilet paper, hand sanitizer, and wipes. And it's interesting human behavior. But people shouldn't have to change their behavior. Your current hygiene, if it's good behavior, continues, because that's how you've been fighting off the codes normally.
We have a member here who mentioned just the other day. He says, "I'm going to go to Chinatown for dinner."
Hey, Chinatown's down 85%.
Yeah.
To me, the important part of promoting this is not just through the mainstream media, but also the Chinese media, non-English media. I'm actually somewhat disappointed in the non-English media, because I've talked to the Chinese Consolidated Benevolent Association president in Chinatown very briefly, and I asked him, why don't you guys hold a press conference with just the Chinese language media to discuss this? And the Chinese language media won't do it. And I think this is, once again, a demonstration of the differential of quality of media between the non-English media and the English media, and what they're willing to report. So why do I say that? A lot of the people who utilize Chinatown businesses, Quincy businesses, don't necessarily live in those communities. This is a very different environment. This isn't the 1960s where your Chinatown people lived in Chinatown and basically ran the economy in Chinatown because they all shopped there, right, and worked there and provided services there. Nowadays, they're living outside the city. People live in Cambridge, Allston, Brighton, Acton, Concord, Randolph, Sharon, Stoughton, Needham, Dover, Quincy, and you can go on down the line. Malden's another location. And they're not coming into Boston. And in some cases, they won't come to Quincy to do their shopping. And a lot of those folks are first-generation immigrants. English is not always their first language, and they have a preference of what they look at media. So they look at print Chinese media, and they're also very dependent on social media that's in Chinese language. And once again, we hit the misconception problem, right?
Right.
What the spread did, that people in the mainstream don't know what's written about it. And as a result, they start to believe, quite frankly, fake information that leads to misconceptions of what's going on.
Let's talk about some legislation.
Sure.
Before the show is over. I do want to bring out about, even if we talk about it briefly, the mobile handheld device, the cell phone in the car, and how that has changed. and how that.
I'm sorry, hands-free driving.
Yes,
I was
I'm
thinking
sorry.
about you have to use wipes on them.
Oh, no.
Because I do Clorox wipe my phone.
Well, yeah, people
Yeah,
are doing
yeah.
that. No, hands-free driving. I'm sorry. I could have said that in a better way.
Yeah, the hands-free driving's gone into effect. There was about 3 months-ish time period from passage of the law to implementation. It's a 3-strike fine system, $100 incremental, and it basically requires people to use a non-wired device to utilize your phone, generally through a Bluetooth device or wired through your car. The vast majority of cars today, the modern cars, have this type of device.
True.
And so you don't no longer hold your phone to your ear. We can make some jokes about some of our friends regarding this, which we won't right now. But it does also try to reduce the possibility of distracted driving. So I've had people push back to me about this issue, but to be perfectly honest, I mean, I've always been run off the road more than once. And the thing I see is somebody with a phone in the ear, driving one car, having a conversation, swerving around, distracted.
Trying to multitask.
Trying to multitask. And I'm there, like, trying not to get killed because, you know, this happened on the expressway. They changed lanes and run through the middle part, and I could see them. And I'm, like, honking them, and they just ignore you.
Yeah.
And this is not the same as, you know, playing super loud radio and you're singing along. You know, it's a very dangerous thing. And texting is the other one. You need 2 hands on the wheel of the car. You have voice command now, on the ability to do that, and you got the speaker device on your car.
Right.
So if you have to make phone calls, you can do it by voice command. Apple Play, Google Play is Google whatever Assist is part of your car systems. So
Yeah, there's no excuse not to go that route.
and we're actually one of the last states to go this direction. I mean, we've been relatively slow. California and New York and many other places have already moved this way. So I understand there's some inconvenience to people who think you got to learn new technology, new device, but you got to really think about this all the way through here. I don't care how good a driver you think you are. It's at nighttime, you have a hand up to your face, and you're using one hand, and you're talking. What are you really paying attention to?
Right.
And now today, the mapping devices are available on your phone, and they can be part of your car, or you can hook it for like not even $5. You can find cheap hooks for your phone onto your ventilation system and whatnot, and just turn up the volume. The GPS is loud enough to tell you. You just turn it to the top gear, and you can tell you where you're heading.
My car, one of my cars doesn't have it, but I put my phone on a clip and I just raise the volume. It's on speaker. We're fine.
I'm always scared when you see people watching videos.
Oh, of course.
I've seen
Unless
it.
they're watching your video.
Unless they're watching this now, obviously.
Right.
But I've seen people do that too, and I get very nervous when people see that.
So let's talk about some legislation that has come out of your committee or your committees.
Well, where do you want to start?
Well, where would you like to start? Let's talk about.
You have the list in front of you.
I do. The Act to address inequality and promote opportunity.
Sure. That bill I filed with the Mass CAPS, QCAP, you guys know, is part of the Massachusetts Community Action Programs. And the bill is designed to give more flexibility to CAP agencies to address needs as things change. Actually, we're in a time period, an example for that. The coronavirus will have a negative impact on the economy. People will need more human services as a result, not just medical.
Correct.
They might find themselves with temporary unemployment. They might have themselves in need for rental assistance as a result. We appropriate money for LIHEAP from the state level for low-income assistance on heating, oil heating systems. So that's administered by the CAP. But given the way the agency is set up, they don't have they need more flexibility to pivot as crises come along and change. And right now we're looking at one. This is an example of a good situation. The challenge, of course, is funding these kind of programs, and that's an ongoing conversation I'll be having with folks at the Ways and Means to talk more about how we're going to help finance this.
How about the economic impact of minimal pricing laws?
Yeah, this is a study group. So most people don't realize there are minimum pricing of many things, such as alcohol, cigarettes, which I don't encourage, and for example, milk. So I think it's an opportunity to bring in a commission forward. It's not actually, the bill does not actually change minimum pricing laws, but to actually have a commission investigate independently where we are comparatively, the impact it has on the economy, and whether or not some of these laws should be changed regarding the minimum price should be on a lot of our essential goods.
Veterinarians.
Yeah, it's a tech correctional bill. This is a so exciting part of my life, where we have bills that basically just updating the laws on current professions to reflect more modern practices. So, for example,
yeah.
yeah, like licensing time periods. You want to be licensed on a consistent basis during a time of year versus showing up on your birthday, for example. We have continuously processing. So
Okay.
some people do it like every January 1st, so you get your license in November, January 1st you got to re-up.
Right.
Versus your birthday, which makes more sense because it's the full year benefit. Or even, there's some flexibility in the middle. Modernizing the code, veterinarians have changed their education requirements. This modernizes, creates flexibility for the board to do things like education.
Yeah.
I'll give you another example is accountants. Accountants, we moved the bill out to allow non-accountants to be partners at the firm. So right now the law says you can't use non-accountants to be a partner to business. A lot of businesses run with an office manager that's superb.
Yeah.
And perhaps because that person not just office managed, but also generates business because they bring in business for the accountants. As kind of incentivization to stay with the business, you can give shares to to that person that brings in business and manage your office. But because the law doesn't allow non-accountants to be a shareholder in your business, that makes it more difficult for them to compete for the best price employee, so to speak.
Sure. Yeah.
There's an easy example of another case of trying to update our laws to reflect, quite frankly, a modern method.
Direct wine shipper license.
This one's actually a bit of a confusing issue. We actually do allow direct shipping of wine, so don't get fooled that this bill is about that. You can direct ship wine for personal consumption in Massachusetts. You can't resell it from your home, for example. It has to come from point of origin. And what I mean by that, the winery that manufactures your wine is direct shipping to you. This is trying to address an inadvertent error or law, loophole in the laws, like whatever you want to call it, that allows non-manufacturers to ship to you, meaning there's a third-party intermediary that's basically a type of clearinghouse.
Okay.
So Mark has wine. I'm supposed to buy directly from Mark that complies
Right.
with the law, but the way has the law is a little quirk in it where you could sell the wine to Joe, and he would be a clearinghouse,
Yes.
and he would ship the wine out, but I'd be buying from Joe instead. So is it a violation of direct shipping wine? Not exactly, because I'm actually purchasing it from you, but using an intermediary. That is not the intent of direct shipping a wine. It should be directly from you. There's no markup
One
in the
line.
middle.
One
One
line.
line, no markup in the middle. If there's a markup, it's at the Mark Crosby wine level, not at the Joe Catalano
Correct.
level.
Okay. What about the storage of alcoholic beverages?
This is regarding a storage and distribution facility, so everyone loves their beer but don't know how to get there. It's like tell people sausage making is not just in government. The law currently only allows a beer distribution company to have storage in one community. Given the fact that the distribution industry has actually grown immensely in the last 75 plus years, and there's been,
Certainly.
a lot in some consolidation because some of the smaller families have retired their industries and sold into another existing distributor. For them to effectively get your beer quickly to different retail locations, they would like to have the ability to have more than one distribution storage center. And why is that important? Well, for them to build a new storage center means they have to keep the one open now, build a new one, and then demolish the old one. So that's jobs and tax revenues to communities actually have that facility. So this will allow them to be licensed to have more than one location for storage. This doesn't change any zoning laws, does not take away local approval, does not take anything out on local review of any kind of construction. It just creates the ability to have a license to have more than one location.
Right.
So if you want your beer fast, this is a great thing for you.
Okay. So it's basically location and I suppose supply.
It's
based.
modernization again.
Right.
This is modernization. The ability to have more than one distribution location means they don't have to build giant warehouses in a place where we're running out of land. And, obviously you can
Right.
spread the property
So
taxes
true.
out. But you can move the product quickly. July 2nd, 3rd, and 4th. Biggest distribution time period.
Oh, I wouldn't be surprised.
So if they had more than one location to distribute out of, they have more storage space, they can move
Yes.
product quicker, and as a consumer and the retailers and restaurants, you'll be able to get your product rapidly. So it's very exciting what I do in my work, don't I? Just a lot of just
Well,
updating.
it's things that, sometimes a lot of us don't even think about. But consumer rights of renters.
Yeah, this one actually came from my chief of staff, Maeve, in the office.
Oh, okay, I know Maeve.
So
What was the genesis of?
she's a renter, and when she rents her place in Cambridge, she discovered that there was a brokerage fee that was equal to the price of the rent.
Uh-huh.
So we all know the rule: first month's rent, last month's rent, and security deposit.
Right.
Now I got to pay the brokerage fee. Now this is actually the realtors are going to kill me now because they're watching this, going, "What are you doing to my income?" It isn't everywhere that does this. Okay, it's certain high rent locations of high demand housing. Brokerage would do this. But here's my problem with this whole philosophy: the landlord hires the broker to find the tenants. The tenants do not have a contractual relationship with the broker at all. They're the customer.
Yes.
So why are you paying the landlord's fee where there's a contractual relationship? And it's a conflict.
point.
Yeah, it's also it's a conflict of interest to represent two parties simultaneously. Lawyers, brokers, bankers. You can't be representing both parties simultaneously. That's just a huge conflict of interest. So the fact you got a landlord that hired a broker, the tenant pays the broker, which implies a contractual agreement, that's a conflict of interest right there. Who is the broker really working for? So why are you paying somebody that's been hired by somebody else to do their job? And I find that kind
That
of...
you have no connection with.
You have no connection. You didn't have a contract with that broker saying,
Exactly.
"Oh, find me a place to live."
Okay.
They're looking for customers. So it also creates a bit of a burden in the housing market when you think about it. First month, last month, security deposit, plus another one. So that's 4 months worth of rent. They got to come up right off the bat. That's challenging. And also there's a provision there regarding re-up time. So now, because they know the housing market's tight, they're asking for people to sign their leases 6 months out from expiration. And it wouldn't surprise me as the market gets tighter, they're going to look for a re-upping lease in 9 months, or they're going to immediately say there will not be a new lease offer at the end. So, people watching this, you think about this, well, it's free market. Yes, it is. I do get that. But would it be fair for someone to make a decision 9 months out to lock into a lease? Or 6 months out to lock in a lease? Generally, you start conversation 3 months out, so people can have enough time to plan where they want to be. Perhaps you have a life change, you get married and
Right.
you move out. Well, now you're going to be locked in for an extra year, half a year before the end of the lease. Because the only what's insurance is that they have that. And gets better. You have to pay the brokerage fee again.
Oh, twice.
And if you bring in new tenancy onto the lease because you're swapping tenants out, you pay the brokerage fee again.
Okay.
So who gets the money? It isn't the landlord.
Right.
But who's working? Who's the one actually working for the landlord? The broker.
Yeah. So
I'm waiting for those angry phone calls from brokers calling in, telling me how unfair I am to them regarding the fact that it sounds like they have a ethical conflict.
Human trafficking, the resource hotline.
Yes, we've been working on some issues regarding human trafficking and how certain trusted places, I would say, that domestic violence and human trafficking folks will talk to and get some advice on where to go. I won't disclose the type of industry because that could lead to them becoming victims. But this one in particular works on a different basis. It's not training individuals to help people human trafficking, nor training them on identification and helping with sexual assault. This one deals strictly on a hotline number to be posted in cosmetology and beauty salons for people who see it, know there's a way to contact for help if you know an individual. It does not require a business to be responsible for identification nor directing assistance, but it does create a mechanism in the environment to do that. And a lot of people who use these type of facilities are women. And you've seen in a lot of news lately, particularly in the Boston Globe, regarding human trafficking concerns, especially the Department of the Professional Licensure. And working with the beauty schools, we've talked about this quite a bit. This is actually done in Texas, in Spanish, Vietnamese, and English, to give people some awareness that you're an undocumented immigrant, but you may not be here of your free will.
Correct.
Or maybe you're undocumented, did come free will, but fell into a situation where you are essentially a prisoner, whether it be through a spousal abuse, family abuse, employment abuse, which is basically slavery, and you don't know where to turn. And perhaps you know a friend that may want to do that. So hair salons, cosmetology tend to be very trusted locations, very non-discreet, and gives people a chance to find a resource that may help themselves or someone you know.
do want to bring to light anything that we haven't touched upon that you might want to bring forward.
Well, tax season's coming around. It's March 12th. April 15th is going to be a middle of the week, and one of the things they should be aware of is the senior circuit tax break for people over 65 with certain income guidelines and property value guidelines, whether they be a renter or homeowner. I understand my colleagues came in earlier today as well
Yes.
as to talk about that, and
They talked about your absence too.
I unfortunately had a conflict, but gladly was able to come later in the afternoon, so I get solo time.
And I did tell them that you would be in the studio.
So, but please do watch that video with my colleagues.
Significant tax break.
Very significant. I can bill you over $1,000 to your home. I do know property taxes are rising in Quincy, and the cost of living is high, but it's a tax credit, which means that even if you do not pay taxes, if you're over 65, you're a homeowner or a renter, and you meet the income guidelines and the property value guidelines, you could be eligible for well over $1,000 in cash. Credits equal cash. So most of the details are obviously in that other video, and I strongly encourage everybody to watch that.
Tacky, I want to thank you for joining me today and giving us an update, and we will have you back in the studio in short order.
Absolutely. Very happy to be here, and everyone please be safe. Use some common sense when in public, and most importantly, cannot emphasize enough the importance of good hygiene.
Well said. We'll end on that note. I want to thank you at home for watching this particular program of Quincy Access Television. As always, please continue to watch QATV for more locally produced programming.